Hello, I'm Martin Woodrow. I'm the Chief Executive of the British Dental Association, and I'm going to give you a roundup of the key developments in relation to the COVID-19 pandemic this week. I wanted to take you through 6 key areas. The first of those is payments to dentists. Well, Monday started with a breakthrough. The Scottish Government announced that they would pay 80% of income from terms of service, but crucially also from patient contributions. And that was a huge relief, especially for our Scotland team who've been working tirelessly on this issue. Meanwhile, in England, we received some much needed clarification later in the week on what happens when mixed practices when it comes to NHS funding. There's been a lot of angst since the NHS announced that practices would benefit from continued NHS funding but would not be eligible for wider government assistance, as this would be regarded as duplicative. So what does that really mean? Well, NHS England confirmed to us that the caveat about not applying for wider government assistance applies only to NHS dental income. So mixed practices can claim for furloughed workers in respect of private income and still receive their NHS income in England. So this is a big step forward. For more on any of these financial aspects, see the relevant pages on the website, the financial impact pages. Lastly, on the topic of pay, we're going to be launching a new pay dispute service for associates. And this is to help associates with practice owners or corporates who are not passing on the income due under that agreement with government. We know that the vast majority of practices will do the right thing, but associate members, if you do find yourself in a situation, do get in touch via the website and we'll try to resolve the issue for you with the practice. The second area I wanted to talk about was personal protective equipment, or PPE, which continues to be a massive area of concern for the entire UK. But yesterday we had some updated guidance which applies to both primary care and secondary care settings separately and includes dentistry. We've got a real concern about a particular aspect of that guidance, which is that it says that a fluid-resistant surgical mask, it continues to be an acceptable form of protection for anything other than aerosol-generating procedures. That's caused some real concern amongst the profession, and we're continuing dialogue with officials in the nations around whether that is in fact an appropriate form of protection. We'll come back to you and update you on that as things develop. The third area I wanted to talk about was risk assessment for urgent care, and this relates to the previous issue of PPE. Because we've still got that ongoing guidance around what PPE is appropriate in certain situations, and it causes concern to us in the profession, what we've done is made a recommendation that all professionals should carry out a full risk assessment, including telephone triage, before agreeing to see any patient face-to-face for urgent care. And for members' benefit, we've put together a complete risk assessment that you can find on our website. So we would urge you to read that guidance carefully before you provide any urgent care. So look out for that risk assessment on the website. The fourth area I wanted to talk about was funding for self-employed workers. So as you know, since the Chancellor revealed that the government's financial support package for the self-employed excludes anyone earning over £50,000, we asked associates some questions about their earnings and the impact of that limit. And you've answered those questions in some strength of numbers, which is great for us because we have now got some clear, very sobering evidence about the impact of that financial cap. We've also learned from separate survey work that around 75% of practices believe that they'll be hit pretty badly in the next 3 months in terms of their sustainability. And nearly all of those practices see the current crisis as a high risk to their long-term sustainability. So we're taking those issues and making our case to government to support private practice particularly, and we're expecting some coverage of that issue from ITN over the weekend, and we'll use the results again to make the case for wider business support for private practices in particular. The fifth issue I wanted to talk about is redeployment. And that's still an issue that's causing high levels of anxiety this week. Our head of advice teams, James Goldman, has produced a video on our site that aims to reassure DCPs in particular on that issue and shares with them what they need to know about redeployment. So give that a watch and share it with your teams. We've also now got more FAQs on this subject, including step-by-step process for employed dentists being asked to be redeployed, and we've got a lot more to come on that issue. The sixth issue I want to talk about is urgent care centres. Much is happening on this front across the 4 countries of the UK. In Scotland, the public dental service has been quick off the mark in setting up emergency dental centres at short notice, and they're already treating patients. In Northern Ireland, they're nearly there with setting up their urgent care system, and Wales is not far behind. In England, we've seen a varied picture. Some areas are nearly ready to go, but some are a few steps away from doing so. We think it's the right way to go, setting up these care centres, but as I've said, PPE is a massive issue, making sure that they've got the right equipment to provide the service they need to. Finally, before I finish, a couple of positive things not related to those 6 areas. We've seen some great stories this week of dentists volunteering, providing meals for NHS workers, donating their PPE to hospices and hospitals, and doing great things, which brings a real credit to the profession. Business as usual in many respects for the BDA in terms of the services we provide, and it was heartwarming to see 300 DCPs around the UK still able to take their exams with us recently. It was great to see so many DCPs excited about taking those exams, and it shows even in this climate that we can all pull together and continue to get things done. So that's all from me for this week. Have a good weekend, and I hope you stay healthy. Bye bye.